Hello, I'm Dr. Leonard Matheson.
This video is for parents, a guide to choosing a great counselor for your teenager. Adolescence is a difficult transition. The body is developed, but the brain is not. Brain development isn't complete for girls until age 21 or 22, and for boys until age 23 to 25. The body can do so much more than the brain can handle. No longer a child and not yet an adult. Poor self-control, risky behavior, and tragic errors in judgment are common. The last parts of the brain to develop are those that support values-based reasoning and emotional self-control. Because the adolescent is out in the world with a full-grown body and an immature brain, the simple getting in trouble for the child now takes a serious turn, with potentially lifelong consequences. The adolescent desperately wants to be independent, but can't handle all the responsibility. In striving for independence, some adolescents become estranged from their families, decreasing their chance for a successful adulthood. Adolescents take on challenges that are greater than their abilities. This is normal and for the most part healthy. But in doing so, they experience failures. Things just don't work out. Failures are common for all adolescents and lead to questions of inadequacy and emotional pain. At the same time, the brain's ability to handle emotional pain is poorly developed. Parents of teens know that emotional pain is a natural part of adolescence. Loving parents want to shield their adolescent from this pain, but these failures signal crises that the adolescent can learn to handle in a way that promotes growth. A good relationship with mom or dad is crucial. Parents shepherd the teen to grow from these challenges without becoming emotionally blunted or developing maladaptive coping mechanisms. Shepherding their teen through these challenges is the parent's primary job, sometimes with the help of a professional counselor. We believe that a faith-based approach to counseling that integrates the latest neuroscience is the best way to help parents guide their teens' transition into healthy adulthood. So, how can a faithful brain counselor help your adolescent? Faithful brain counseling is a Christian approach to counseling that integrates faith and neuroscience. A faithful brain counselor has several advantages that aren't available elsewhere. The context of faith is crucial. Faithful brain counselors use cognitive behavioral therapy and interpersonal neurobiology that we ground in the Bible, especially the lessons and the model provided by Jesus. The focus for the faithful brain counselor is on the commandments of Jesus to love God with all our heart and soul and mind and strength, and love our neighbor as ourselves. The faithful brain counselor educates the adolescent on how this unfolds in the brain's neurobiology and how important the commandments of Jesus are for brain health and fitness. This tends to make a lot of sense to Christian adolescents, some of whom are struggling to integrate their faith with what they're learning in school. The perfect relevance and maturation of their childhood faith within the context of neuroscience shines very brightly. There are four main themes for faithful brain counselors as they work with adolescents. First, make better choices. Second, learn effective coping skills. Third, identify personally meaningful values. And fourth, develop a God-honoring purpose. We start with helping the adolescent to make better choices. In the struggle to become independent and the confusion of breaking away from close family ties, adolescents sometimes get lost. On top of this, the mismatch between an immature brain and a mature body leads to risky behavior. We help the adolescent evaluate her character strengths, both those that are signature or strong character strengths, and those that are lagging character strengths that can be further developed. The second is to help the adolescent learn effective coping skills. This is really grounded in the love your neighbor as yourself commandment and how it affects the adolescent's neurobiology. And the beautiful part of this is that character strengths develop in the service of effective coping skills. As this unfolds, both the coping skills and the character strengths are reinforced. Now, adolescents yearn to be independent and are going to develop coping skills no matter what. Many adolescents develop coping skills that are adaptive in the short run, but maladaptive in the long run. A little guidance and coaching to try healthy strategies as the adolescent moves through an increasingly chaotic social world can go a long way toward a successful launch into early adulthood. The third faithful brain counseling theme is to help the adolescent identify personally meaningful values through a process that we call values-based goaling. We do this by exploring what do you want most, a question that taps into the adolescent's core values. The neural networks that represent core values have developed throughout childhood. Parents and engaging teachers and other caregivers have been the primary source for the adolescent's core values. The Faithful Brain Counselor will help the adolescent develop personally meaningful values so that they come to the fore and become her dominant neural networks throughout the rest of adolescence and into adulthood. The fourth theme is to help the adolescent develop a God-honoring purpose. This is easier for adults than for adolescents, but it's a process that can begin now. Adults have more personal clarity, but the thinking through that is required to develop a God-honoring purpose for life can begin during adolescence. This unfolds gradually as the adolescent pays more attention to her core values and how they're represented in personally meaningful goals that guide choices. These choices are guided by the life plan that comes out of values-based goaling. The life plan guides proper choices. For the adolescent in junior high or high school, participation in church and selection of school projects and extracurricular activities is a way to explore their purpose. For the adolescent in late high school or college, participation in church and selection of electives in school, helping them move towards a major in college, is a way to explore their purpose in life. These choices, rooted in the child's core values that originated with her parents, shepherding her through adolescence, will lead to a career that will help her eventual purpose to be God-honoring. Remember that you've planted your values in your adolescent's brain. They've developed basic neural networks that can help the adolescent sort out the chaos of their teens and early adulthood. Speaking now as a father, I can tell you that the goals and purpose of my children reflect our family's values. No matter what your child gets into in adolescence, those values will shine through and provide the foundation for healthy adulthood. This is how I help parents at my church and counselors I'm training to explore a new counseling relationship. Initially over the phone and then in person before the counselor meets the adolescent, we go through this process. Telephone screening, office consultation, and these eventuate in an initial family session. We need to make an investment of time and a little bit of money to select the right counselor. Begin with a telephone call. Ask about the counselor's training and certification. If your teen has a specific problem, such as an eating disorder or an addiction, you'll need to have a counselor who's got this experience. Also ask about licensure status. Although it's generally true that a counselor who is an intern or provisionally licensed is not as skilled as a licensed counselor, there are noteworthy exceptions. There's a broad range of skill among licensed professionals. At the same time, people who are in training may have a lot to offer and will be less expensive. If you're considering someone who's not yet licensed, ask about their supervisor. The quality and experience of their clinical supervisor is important for you to consider. The first 3 years of my practice, from age 22 to 25, I was working with teenagers, but I was not yet licensed. I was nowhere near as skilled or knowledgeable as most of the older counselors, but I was much more effective because my teenage clients and I could quickly develop meaningful and mutually respectful relationships, and I was very well supervised. Also, look for a counselor who has some knowledge about brain function. The last 10 years has given us an explosion of information about the structure and function of the human brain. Much of this is relevant to up-to-date counseling. Counselors who are keeping themselves current should have some knowledge in this area. And then, if it sounds like there might be a good fit, ask whether the counselor is on an insurance panel. If not, ask how the counselor helps parents meet their annual medical deductible and handle out-of-network reimbursement. The next step is the office consultation. You'll need to pay for the counselor's time, although this will not be reimbursed through insurance. It's a necessary investment on your part. This is the time to explore the match between the counselor's values and the family's values. Values help to organize a potentially chaotic adolescent brain. A faithful brain counselor will be respectful of your values and help to build on those neural networks in God-honoring ways. So I want you to feel absolutely fine telling the counselor that you want to be sure that his or her values are a reasonably good fit with your family's values. With an open mind, ask about the counselor's faith or religion, or their approach to that often difficult topic. All counselors are required to take their clients' faith and religious values into account. If an even-handed question from you elicits a reasonably good response, that's a good start. The next step is to explore likely issues that your adolescent is experiencing. From your own perspective, what's going on and what have you tried? What has worked and what hasn't worked? The last step in the office consultation is to consider boundaries and ground rules. A good counselor knows that the parent is very concerned about their legal responsibility for all harm that the teenager does out in the world, like driving while drunk, or hurting someone in a fight, or an 11th grader sexting with an 8th grader. These are all examples from the past month of mid-teen problems that occurred in my practice and in the caseloads of people I supervise. So, before you have the office consult, talk with your spouse or an emotionally healthy adult friend about what information you are willing to not need to know about. If this is your first or only child, this is going to be a growth step for you. The parent must not abdicate responsibility and ignore what's going on, but needs to develop a trusting relationship with the counselor. This is more likely to happen if the family's boundaries are discussed in the office consultation. So now we come to the initial family session. You will have arranged with the counselor to come in with your teenager for several minutes and excuse yourself after you affirm the family's commitment and love for the adolescent and describe your understanding of the negotiated boundaries and ground rules. Most of the time in the initial session will be in private between the counselor and your teenager, so your counselor can review the teenager's issues and concerns. The counselor will have been primed to gently probe based on the office consultation. The goal for the counselor will be to establish rapport with your teenager so that he or she will want to return for a private session. The date for the private session is negotiated between the counselor and the teenager, with the latter arranging with parents to fit into the family schedule and address whatever transportation needs there might be. I'm sure you remember the first few weeks and months of your child's life and how your infant was so precious. Well, they're still precious, although they are more worrisome. You've gone through a careful process to select a counselor to address problems that are making life difficult for everyone. You selected a person whose values are reasonably close to your own. As problems come, and they will, do the best you can. When you reach a stalemate, you can get some comfort by saying with genuine love and support, be sure to bring that up with your counselor. So, thank you for considering my suggestions. If you want to learn more about faithful brain counseling, my book describes 3 different teenagers who face serious medical challenges and how they develop the ability to live life to the full. Check back on this channel from time to time for additional information. It would be great if you subscribed. Your support is important to us. If you'd like to be referred to a faithful brain counselor, we can help. The counselors we have trained will be perfectly fine with this process. Even more importantly, the counselors we train have a pretty good understanding of what's going on in the teenager's brain and how important core values are for developing a God-honoring purpose in life. We love working with adolescents because of all the promise they bring, and we appreciate the opportunity to help you help them realize that promise.